Delusional disorder. Delusional disorder is a mental illness characterized by recurring non bizarre delusions. The main feature of this disorder is the presence of delusions, which are unshakable belief in something untrue. People with delusional disorder experience non bizarre delusions, which involve situations that could occur in real life, such as being followed, poisoned, deceived, conspired against, or loved from a distance. These delusions usually involve the misinterpretation of perceptions or experiences. In reality, however, the situations are either not true at all or highly exaggerated. For most people with this condition, delusions center around one specific theme. Therefore, mental health professionals subcategorized it into five groups. They are erectomanic, grandiose, jealousy, somatic, persecutory, and mixed. The first one is erectomanic delusional disorder. It is illustrated by the sufferer's adamant belief that someone else is in love with him or her from afar. Grandiose delusional disorder is characterized by the power and supreme importance. Whereas when a person obsesses about a romantic partner's fidelity, jealousy delusional disorder is present. Somatic delusional disorder is described by a sufferer's belief that he has a physical defect or medical problem. Next, persecutory delusional disorder. It occurs when an individual thinks that he is being mistreated or conspired against. People whose fantasies fit in more than one of these categories are said to have six type, that is mixed delusional disorder. Regardless of these types, most people seems to be functional and socially normal outside their delusions. And this inconsistency make this disorder interesting, and researchers started looking at the role of various factors that lead to the cause of delusional disorder. As with many other psychotic disorders, the exact cause of delusional disorder is not yet known, but researchers suspect that people with delusional disorder have an imbalance of certain neurotransmitters in their brains. They have also found that people with this condition, their immediate families are more likely to develop it, and thereby indicating the genetic factor involved, as well as certain environmental or psychological factors like stress, alcohol, or drug abuse may also contribute to this condition. When we look into the symptoms of delusional disorder, the most obvious symptom is non bizarre delusions, and other symptoms include an irritable, angry, or low mood. And hallucination is also one of the symptoms, where people seems like they are seeing, hearing, or feeling things that are not really there. Regardless of the cause, if a person is suspected of having this condition, other illnesses like schizophrenia must first ruled out, and this can be done by DSM-5 criteria for delusional disorder. So it has criteria A through E, so 5 criteria. The first one here we see a presence of one or more delusion with a duration of 1 month or longer. The second criteria is that the first criterion for schizophrenia has never been met. Third criterion here, other than the effort of delusional itself functioning, is not markedly impaired and the person's behavior is not odd or bizarre. So it's important to point out here that the delusion can be odd or bizarre, but the behavior cannot. And often we do see odd and bizarre delusions with delusional disorder. The fourth criterion, if the individual experienced major depressive episode or manic episode, those episodes have been brief in comparison to the symptoms of delusional disorder. And the last criterion is the symptoms cannot be better explained by another mental disorder or medical conditions. Once a diagnosis is made, the cornerstone of treatment, psychotherapy, can be begun. In some people, individual talk therapy is helpful to recognize their disordered thinking. At the same time, cognitive behavioral therapy make it possible to change delusional thought patterns. And family therapy can also help families to deal more effectively with loved one who has delusional disorder and enable them to contribute to a better outcome for the person. Psychotherapy is also supplemented with one of the many types of antipsychotic medications, such as conventional antipsychotics, which is also called as neuroleptics. These work by blocking dopamine receptors in the brain, which is believed to be involved in the development of delusions. Newer medications, also called as atypical antipsychotic drugs, appears to be more effective in treating the symptoms of delusional disorder. Other medications that might be used to treat delusional disorder include tranquilizers and antidepressants. Tranquilizers might be used if a person has a very high level of anxiety or problems in sleeping. Antidepressants might be used to treat depression, which often occurs in people with delusional disorder. It is important to note that there is no way to prevent delusional disorder. However, early diagnosis and these treatment can help the individual to experience a great deal of relief and decrease the disruption to the person's life, family, and friendship. So, if you believe you or your loved one is affected by these symptoms, it's very important to make an appointment with a mental health professional. Thank you.